PRRS is still the main challenge on our farms. When you think you've got PRRS under control, you have PRRS again. So, the fight goes on, and we keep standing by your side, as we have done for 10 years now. We have sold 215 million doses, with a supply guarantee over these last 10 years. We have demonstrated protection against highly pathogenic strains, and our hipradermic needle-free device represents a step forward in intradermal vaccination against PRRS. The fight against PRRS goes on, as does our commitment.
Well, good morning. Buenos dias. Hope you enjoyed last night's event. And I really liked this wonderful setting in the middle of Seoul. And even today we have a little bit of rain. It's good for study, not for the travel around. Okay? Well, thank you very much for the invitation. I'd like to congratulate HIPRA organizing this wonderful event, first event actually, in Seoul. Dr. Robert Host, he introduced global overview of a swine industry and what we need. And I'd like to narrow down a little bit in Asian continent. And even though getting a little smaller, and I will talk about the main problems. Well, you may not agree or you may agree. What I'm thinking, the main problems in pig health in Asia. That's the main theme what I'd like to discuss today. Robert already mentioned the demographic features of the world populations and pig populations where pigs are growing, all those. But the Asian families, we do produce maybe more than 50% of the pork. Well, when Robert mentioned that when your GDP goes up, the animal protein consumption is increasing. That's just reminded me my poor English. When we say pigs and cattle, those are peasant language, and the pork and beef and muttons, those are actually the riches, consumers' language. So when you make more money and then you actually consume more animal proteins, that's good. The Asian economy gradually goes up, and we need more animal proteins. We become a peasant to richer. Okay, this is what I like to point out. This data, very interesting data I retrieved from the OECD, and everybody agrees that China is the #1 producer, and China is the #1 consumer for the pork. But interesting enough, 2021, China dropped down to 3rd. Okay, that is actually my topic today. I'd like to talk about disease in Asia. In China, traditionally, any written historical document, China was the #1, no doubt, but it became a 3rd. That's because of ASF. One disease bring down the world #1 to the gold medal to bronze medal. So that's very, very, I think, important data, why and how important animal disease is. and we have to control those. I'm glad to hear that the HIPRA now invests money to developing ASF vaccines. I will talk about ASF vaccine a little later. Okay. Since Industrial Revolution, all the technology, ideas, and science evolved and developed, improved, but we're having more problems. We start adding a problem over another problem. As you see here, even our pig industry, we have new challenges. Environmental issues and animal welfare issues. Those become a really not big issue. It's bigger and bigger issues in some countries, like in Korea. You may not be able to open new farms anymore. Your neighbors never allowed to do so. And government authorities will not give you any license anymore. The only way you like to have your own pig business is purchase a farm from the existing farmers. Even though you may not be able to rebuild, renovate, decorate your farm, very, very, the strong resistance there. And even here, we have a labor shortage. Robert mentioned smart farms and technologies, but still we're shortage of labors. Japan might be the same, and then Taiwan might be the same. We do face labor shortage. And then another one I like to emphasize to you is, since you are pig expert, and especially focus on the swine health, do we have enough experts? That's good. I'm still a professor at this school. I was the dean for the college. I was dean for the graduate school. Did I do my responsibility as an educator, as a vet school, the teachers? In school, over 90% of the students, they are way shifting to the companion animal, not food animal anymore. No, whenever I'm asking, hey, does anybody want to be a pig veterinarian, poultry veterinarian, or cattle? You like to do your own career business? None or one or two. That's it, out of 100. Okay? How many pig veterinarians in Japan? Here, very renowned Dr. Satoshi Otake is. Maybe he's the only one. Unfortunately, I'm sorry to say, but the Korea might be the same. Do we educate enough people and substitute enough experts for our industry? I think that is one of the big issues. We have to put the ideas together and then find some solutions. Unless we have an expert, we may not have sound production anymore. And then I go to the health issues. That's what actually I got an order from HIPRA to do so. Okay? First one is African swine fever. Yes, this is the main disease in Asia now, at the moment. Even in Korea, maybe not by today, by this week, we had 3,000 1,800 cases of ASF. Among them, 40 cases of domestic animals, domestic pigs. And then even in this month, we have 32 cases of wild boar positive. See? Unfortunately, we don't have vaccines. Vaccine development is on the way. Personally, I have my colleague working on the vaccines, some positive results, but long way to go as a commercial vaccine. Since late 50s till now, it's already 65 years, around 70 years. We are developing vaccines, but no commercial vaccine. Well, a couple of vaccines from the Vietnam, but there are issues, okay? Safety issues and efficacy issues of those. But the ASF is one of the main diseases in Asia. In Asian continent, we have this starting date and still going on all the from China to Singapore. Outbreaks in wild boars are the major, and then we have domestic outbreaks as well. So many cases of ASF positive from the hand carriers, food, hamburgers, and travelers they are bringing, pork product. Don't ask me how accurate, how precise these numbers are. Okay, we never able to diagnose the, every single animals in the mountains and everywhere. As well, some of the countries, they are not reporting immediately to the government authorities and even to the World Organization of Animal Health. But still, as you see here, I'd like to see the overview of the ASF. ASF is in whole Asian continent. It is a problem. This virus is just next to your neighbor. When it comes to your farms, that is a matter of times, matter of days, not matter of months or matter of years. So we do have real big problems with ASF. And since the pathogen is the virus, we do not have any antibiotics or any chemicals to treat this disease. Only way to prevent the disease is the vaccine. And then the method might be biosecurities and on and on. And then as I told you, we start to develop this vaccine since 60 years. First candidate is modified live vaccines. Vietnam, couple of vaccines already released. Those are the modified live. Why? Because there was all the molecular techniques are developed and improved. Even COVID-19, we use messenger RNA vaccines. I made coronavirus messenger RNA vaccines about 20 years ago with Dr. Hank Harris. We sold some vaccines in Philippines. I didn't make any money, but Pfizer's and Moderna's, they made zillions of money. Well, those technology works for the human. Why didn't adapt to the animal disease, but the ASF was not that easy. Okay. Killed vaccines didn't work. Recombinant proteins didn't work. Recombinant protein plus DNA or RNA cocktail vaccines didn't work. When we tested those vaccines in animal, even recombinant vaccine without genetic material killed pig even day earlier. That's not promising, that is not promising. So there are only, so far, only the promising candidate is modified life. How we know that? Sardinia, an island in Mediterranean Sea, had a ASF based on the epidemiology. Around 70% of pigs in Sardinia already ASF positive, seropositive. Because pigs didn't develop humans, they developed their own vaccines. What we learned so far is when virus transmit from pig to soft tick to pig, the sylvatic cycles, genetic materials are very, very conserved, even 100% conserved. But since 2007 Georgia cases, when virus move pig to pig, wild boar to wild boar and wild boar, virus mutates so fast. And now, in the field, even the genotype 2 viruses are less virulent. Well, not all of them. Some less virulent strains are start to appear. That's how in Europe, even in US, we're starting to look at the genes, all these gene deletion vaccines. These ideas are coming from those mutants, CD24s and some multigene families. We are starting to cut out some of the non-essential genes, which may be responsible for the pathogenicity, and then we start developing vaccines. When can we have a vaccine in the market? My gut feeling is in 10 years, not in 5 years. We may have the vaccines. Even last week, we tested some vaccines in pigs. Very promising result what we got, but still, for the commercial release, it will take some time. Okay? As I told you, subunit vaccines, DNA vaccines, RNA vaccines, all these are not very promising. Vector vaccines as well, so many groups are tested, P72, and although 56, all different combinations and one or more genes we have tested didn't work. That means they are stimulating immune response, but not enough for the protection. Okay. So what we learned? The Asian continent, we do have ASF. Even in China, now we have a genotype 1 and 2, and recombinant viruses start appears. So that is another big concern. The virus first outbreak in Asia was the genotype 2, which is very pathogenic. And unfortunately, genotype 1 has been introduced in China. I think that's some greedy people, they try to develop a vaccine with the genotype 1. And then it has been released in the field. And now two viruses are combined. now we are at risk even existing diagnostic tools like PCR may not work. So if it escapes, give a more chance to spread out the virus. So it's not good news, but it is what happens in the field. Okay, in summary, we are trying to develop the vaccines, but vaccine is not available in a short time. Okay. And another one thing is we have still lack of information transparency in the ASF in Asia. Next one is classical swine fever. Okay, this classical swine fever is, as you know, this is a very old disease. It has been in swine industry since 1930s. Still in Asia, the classical swine fever is the endemic. Currently, classical swine fever has 3 genotypes, 1, 2, and 3. Currently, in Asian continent, genotype has been shifted to genotype 2. Well, I don't like to go in details in molecular biologies on those, but only one thing I'd like to emphasize here is in China, several years back, the farms vaccinated with the C strain of the modified life, they did have a classical swine fever outbreak. That happened to be a genotype 2.1D, which is actually the case of Kihu, Japan's outbreak strain was 2.1D. And then as well, in 2016, I got one isolate from little north of Seoul that was 2.1D. So 2.1 and 2.1D is start spreading out in Asia. And we still don't know whether this can escape from the existing vaccines or not. But based on what Chinese study, only literature review, 2.1, the existing vaccine may not 100% effective. So, Japan, since 2018, the viruses are spread out via wild boars. It looks like under control, but it's spread out too big. Okay, so viruses are, we did complete sequencing, and the concern, what I was talking about is the 2.1D become a dominant some part of the Asia. Okay. I will go quick. CSF in Asia, genotype 2 become a dominant, and then wild boar is the major reservoir for the virus, and CSF is still endemic in some Asian countries. So far, it looks under control, but what we see is the tip of iceberg. Okay. I will not talk about the PRRS because this session is for the PRRS. But the PRRS is the disease, as you know, not easy to control. Not easy to control in terms of virology, in terms of immunology. virus knows how to escape from the immune system. And then as well, virus evolved day after day, okay? So porcine reproductive and respiratory syndrome virus, you saw all these. The PRRS1 only had some subgroups, A and C in Asia, in Korea, what we saw. That means we do not have very extensive genetic diversities, but PRRS2, it has been here longer than 20 years, and because of here in not much of the outside input of new viruses, Korean viruses are locally, independently, they evolved and then make a new lineage, which is Korean type C, B, and A's. So this is genetically way different from the viruses in other even Asian continents. Okay. These are PRRS1 and different genetic makeups. PRRS virus has just different genotypes, okay? Not serotypes. When we talk about the difference in the genetic makeups of the viruses, people, oh, they might be not working with the existing vaccines. That's different. Like COVID-19, this is variant of interest. Like me, virologist, we like to know where virus goes. We just isolate virus and where is the major changes. That's what we're looking at. Even this is not the variant of concern. You know the variant of concern, which is the new variant is not working for the existing vaccines anymore or less effective. I don't like to talk about that, but these are the pictures, what we obtained from the field viruses and then how they changes, okay? Japanese data. Unfortunately, Japan is, we do not have type 1 data yet, much of. Japan claims they have only PRRS type 2, North American types. And then Japanese scientists classified here 5 clusters in Japan, okay? So these are the cluster of the North American type of PRRS virus in Japan. China. Well, China has lots of data. So many papers. Even maybe 100 papers per day now. Okay? Which one I need to trust? I don't know. So, just highly pathogenic PRRS virus in China. Okay? As you see here, big outbreaks of highly pathogenic. And then the highly pathogenic PRRS virus is controversial and then debatable in many countries. Is this really highly pathogenic? Yes, the Hubei strain is highly pathogenic. I agree with that. But the other strains now, the lineage 1 and lineage 5, highly pathogenic, Minnesota, 34-like, whatever. Is that really pathogenic? We do not have clear evidence for that highly pathogenic PRRS virus yet. Okay. So, field virus continuously evolve. They do PRRS virus genome is around 16 kb in length. ORF5 is less than 5% of genetic makeups. At the beginning, like late 90s and even till early 2000s, ORF5 seems very important. But ORF5 is not very important gene anymore. But still, lots of scientists, they classify PRRS virus based on the ORF5. Personally, I think this is a wrong idea. You should not do anymore. It's only 16 kb. You have to complete sequencing. It doesn't take a week. This one day is enough for full sequencing. Okay? You have to provide more precise data, not to confuse the people. Okay? And then another one I like to talking about is porcine epidemic diarrhea. As Robert mentioned, when you like to sacrifice pigs, do as early as possible. But if you don't produce pigs, your business is out of control, okay? So PED kills piglets in a week. If you have infection in a week, wipe out. 100% piglets are dying, okay? So that's why if you clean up in a week, it seems like your farm doesn't have any problems. But actually, you do have problems. In Korea, if my information is correct, Taiwan, Philippines, even Thailand, PED outbreak is ongoing. Okay. This is the another issue again. PEDV, now the dominant genotype is G2.X, like G2B. Okay? Again, this is not the serotypes, it's genotypes. Lots of people say, okay, PED virus pathogenicity has been changed. No, it's not. Because, like Korea, we extensively vaccinate against PEDV with modified live and killed vaccines. They usually vaccinate modified live before farrowing ones, and then give 2 shots of killed vaccines. So we try to deliver maternal antibody to piglets. If you protect a PEDV in piglets for 2 weeks, then it's done. Actually, you can save the pigs. If you have an infection less than a week, piglets, they will die. Okay, that's why maternal antibody is only way you can protect your piglets from the PEDV. Okay? So, many people are working on the sequencing, analysis of phylogenetic trees, or bootstraps, whatever, because they provide their money, they can do it. But they actually don't show the evidence of changes in pathogenicity and protection with the existing vaccines at all. Okay, in China as well. This one is collected data from the papers, what kind of genotypes are circulating in China. As you see here, G1 through the clade 6. So many different genetic makeups in PEDV in China. In Japan, again, as you see here, I didn't have very recent data, but the G2 is as well dominant genotypes in Japan. Okay, so unfortunately we have the virus, but fortunately we do have vaccines. Modified live and killed vaccines, they show limited efficacy. At least you can save the piglet with biosecurity. If you have good biosecurity and good maternal antibodies, you can save the piglets. So maternal-derived passive immunity is the prime source for the protection. If you have very good vaccination and very short-term good biosecurity, you can save pigs from the PED viruses. And another one is porcine circovirus. Yes, porcine circovirus as well. After vaccination, the viruses are evolved from the PCV1 and then 2 to A, 2B, and 2C, 2D. Recently, several years back, I published PCV3 and 4s. Yes, they do have those viruses in the field. 3 and 4, how important for the clinical outcomes, we don't know yet, but 3 has been reported some importance in the reproductive failures and in fact, heart. But still, we need some of the work. But recent, as concern on the PCV2, 2D is a dominant, and now the papers are starting to publish that the PCV2D-based vaccine is a little more effective than PCV1 or 2A-based vaccines. That's what we learned so far. Okay, my time is up. Thank you very much for your attention. I know this, some data I collected may not precisely reflect what happens in the field even in your countries, but these data are probably published, that officially published data that is available, and that way it's less controversial for the audience. And I hope you enjoyed the rest of the first session. Thank you very much.